Welcome back to Public Health Impact. We are talking about disaster management today, and we're in the Institute of Health Management in Mass Destruction Defense, IMAD. And joining me now is Dr. Kurt Harris, who is an assistant research scientist here in the Institute and in our department. Kurt, I know you're going to talk to us a little bit about what the Institute is doing for our healthcare workers around disaster planning and management.
That's correct. Starting in 2006, the University of Georgia partnered with the Department of Community Health and the Georgia Hospital Association to travel around the state and design, plan, conduct, and evaluate disaster preparedness exercises in all 150 hospitals within the state.
Wow, so you are actually going to every single hospital in the state of Georgia?
That's correct. To date, since 2006, we've been in approximately 90% of the Georgia hospitals, and we designed exercises based around their hazard vulnerability analysis, which is the disasters that are most likely to occur in that particular region.
And what do these exercises entail?
Well, one exercise that we just recently conducted was in Atlanta. A lot of people, when they're traveling around these interstates in Atlanta, which are very busy, don't realize the amount of tanker trucks that are actually traveling right beside them.
Oh, trust me, I drive 285. I know exactly what you're talking about.
Well, a lot of these tanker trucks carry really dangerous chemicals that are hazard to human health. And if they were to leak, then we could have a big problem on our hands. So what we did was we designed an exercise that simulated 3 tanker trucks being exploded on 3 of our major interstates in Atlanta. From this, we looked at the vapors that would come from the truck and where they would be going based on wind directions of that day and census data from that day to generate the number of casualties that would report to our hospitals in the Atlanta area.
And so how many casualties did you predict?
We predicted about 1,400 based on the chemicals that we used that particular day, arriving to approximately 22 hospitals within the Atlanta area.
And what kind of lessons did you learn from the exercise?
One of the main things about exercise is that it's a common theme in all the exercises that we do is communications is a big issue, and we have to work on our ability to communicate externally as well as internally within the hospitals.
So what are your next steps?
Next steps, we're looking forward to going out this year. Our exercise season's about to start. We'll be going into 4 regions this upcoming year. One particular one that we're going to be doing is a regional decontamination team exercise. Well, a lot of people don't realize is that hospitals, they're strapped for cash just like everyone else with this economy that we have, and they don't have the decontamination supplies that we need or the trained personnel that we need. So we're going to be going to the hospital and pulling a team together in that particular region to try to do the greatest good for the most number of people that we can.
That was great information, Kurt. This is just another example of the important work that the Institute is doing to help Georgia prepare for disasters of all kinds. We're now joined by Suzanne Smalley, who's the Special Needs Program Coordinator. Suzanne, how do you define special needs?
For the sake of what we do, special needs is considered those people, vulnerable populations such as the elderly and disabled that live in congregate facilities such as nursing homes, assisted living, and hospice.
And in Georgia, do we have a large special needs population?
We have a little over 3,000 facilities that serve potentially 73,000 individuals.
So I remember Katrina very well, and I recall that the senior citizens there had some issues going on. What exactly happened?
There are a few things that happened. The main thing is that they didn't have proper disaster plans in place. They had no clue how to respond if there's a disaster. So for example, some of the elderly were left. They were just abandoned. Generator, for example, may have been stored in the basement. Well, the first thing that happens during a flooding situation is your basement fills up. So they didn't have backup for oxygen tanks or any other kind of machinery that those patients needed for their health.
So tell me, what is Georgia doing to prepare for a similar event happening here, especially around our vulnerable population?
One of the things that happened as a result of Katrina is that the federal government said, wait a minute, we can't have this happen again. We need proper disaster plans in every state. And so what Georgia's doing is making sure that there's a computerized system to help track what's going on at these facilities, what type of patients or residents that they have there. And so we're working closely with state community health. We've worked with the assisted living facilities, hospice, and nursing homes to get their input so that we have a system that works for everyone. And so what that system will do, if there's a disaster, state community health folks and emergency officials can tap into this information so that if they can't actually speak with somebody at those facilities, they have access to their data and their disaster plan so that they have an idea of how to help them.
Oh, so the system actually tracks all of these facilities across the state?
It does. It does. And that information is crucial because they're kind of on their own out there. And so this allows that information to be shared from afar so that they can help and work with the local emergency folks to help this vulnerable population.
And Suzanne, how would you counsel one of our viewers who's concerned about their grandma or grandpa who's in a nursing home or a disabled child in a facility? I mean, how do you counsel them to make sure that their loved ones are in a good place in case of a disaster?
Generally speaking, when you choose a facility, you're worried about what kind of food you're going to get and what the cost is. And so things that we don't even think about is what happens in a disaster, what's going to happen to grandma or grandpa. And so it's asking, what are your plans if there's a disaster? Where will grandma and grandpa go? How will I communicate with them? And how do I know that they're going to get the medical care they need if they're stuck in a long-term transport situation?
Thank you, Suzanne. That was very helpful information. Coming up next, Cham's going to join me and we're going to talk about what you, the viewer, can do in the event of a disaster in your community. We're going to end today's episode with me. What can I do to prepare for a disaster? And so, Cham, tell me, what do we have out here on the table?
Well, this is my colleague, Ed Roller. He's the Emergency Communications Manager at the Institute. He's assembled this bag. This is what you need, the emergency bag for a family. People also call it a bug-out bag. In this, you would need things like water. Nobody goes anywhere without water. Electricity will probably be off in most disasters, and that means you're not getting any water out of the tap.
Well, so what if I don't know this in advance and I don't have water on hand?
Well, you've got 5 gallons of water in the tank behind every commode. Emergency, you can drink it. I know you might not want to drink it. I wouldn't go out of the pot itself, but just in the tank behind the commode, plenty of water.
Okay.
Communications is also important, so you make sure you get a radio. This one does not use batteries, but it does have a hand crank so you can charge them up. This gets both weather and news.
Okay. You wouldn't think this would be important, but in a crisis, a can opener. You have all this canned food, you can't get at it. People injure themselves trying to open cans without them.
That's right. Maps are important. You need a local map and a state map, just in case you have to get out of town.
Well, Ed, can I use the GPS on my car?
Most likely not. There may be problems with the satellite system. I wouldn't trust it. It may work, it may not.
Okay.
Of course, everybody knows what this is. You
Duct
need
tape.
duct tape. And of course, you may need some kind of plastic, either to keep you off the ground in order to keep hypothermia from occurring because you lose all that heat into the ground, or to kind of seal up your home to protect yourself.
You may also need tools. I carry two types of tools. I carry a utility knife that has pliers and knife blades in it, and then a tool that has wrenches and drivers with it.
Okay, medicines. Everyone can get a medicine pack together. Antibiotic cream, gauzes. You can buy these, but probably the best thing to do is assemble it yourself. And of course, prescription medications. It's a good idea to have a stock of these around.
Light is always important. I have 2 different types of lights here. One of them is the crank type, so you can keep it charged and don't run out of light. However, you may need your hands to change a tire or work on your engine or get your children together or carry bags. So a headlamp is always a good idea.
Gloves. You wouldn't think gloves would be so important, but they are to protect yourself from disease. And it also helps you to help others without endangering yourself.
You know, one thing you haven't mentioned yet, Cham, is money. Is it the case that I'll be able to use my credit card, so not having cash on hand will be okay?
Probably not. I wouldn't count on a credit card for anything in a disaster. You should always have cash on hand. Several $100s would be the way to go on that.
So what about security, Cham? I mean, I remember Katrina and the lawlessness that occurred in New Orleans. What should I do to prepare my family for that?
It was pretty bad at Katrina, and you can expect that kind of event or series of events in the future as well. You really do need to take preventive measures. Different people are going to take different measures for that, but I will say this, you have to obey the weapons laws of your state. They don't go away in a crisis. I would recommend that you take security precautions.
Well, I just want to thank you, Cham, and thank you to your colleagues here in the Institute. I know I really learned a lot today about what Georgia is doing to prepare for any of these types of disasters that we've been talking about, and you've given me some really good information on what I can do to prepare my family as well.
Well, particularly for natural disasters, it's not if, but when. But also for man-made disasters, we're entering a critical phase in the history of our country, and we can expect more of that as well. But we're not going to despair, we're going to prepare.
Well, thank you for joining us for this episode of Public Health Impact. Our next episode will be focusing on the field of gerontology, where we'll be talking to experts on how Georgia can prepare for our aging population.